Today we are speaking with Dr. Steven Zavinsky, a podiatric surgeon at the Detroit Medical Center. As a member of the Department of Orthopedics and Sports Medicine at the DMC, Dr. Zavinsky will be sharing what athletes, coaches, and parents need to know to help prevent foot and ankle injuries and treat them when they do occur. Dr. Zavinsky, how are you doing today?
Doing well, thank you.
Thank you for coming on. For those listening, what are some of the most common foot and ankle injuries you see in athletes?
The most common I'll see is ankle sprains. I also see plantar fasciitis, which is otherwise known as heel pain or heel spur syndrome. And then, when they get bad, you see ankle fractures, metatarsal fractures, ruptures of certain tendons, but those are very, very rare. And in children, adolescents will see something called Sever's disease or calcaneal apophysitis, which is basically right where the Achilles tendon attaches to the heel, they'll get some inflammation, and with activity, the children will start having pain. And it can be debilitating, but it's basically self-limiting, and there's exercises and things we can do to help treat those, and they get them back to their activity real quick.
And you touched on ankle sprains. When we talk about those and strains, what's the typical recovery time when we're looking at high school athletes?
It really depends on the grade of the ankle sprain. So the most common ligament that's sprained is the anterior talofibular ligament, which is on the outside of the ankle. It occurs when the foot inverts and the ankle rolls, and so you're rolling on the outside of your foot. And so with a grade 1 ankle sprain, the ligament is stretched, it's not torn. And typically, we implement something called RICE, which is an acronym for rest, ice, compression, elevation. If we do that, normally within 2 to 3 weeks, we will have the patient return to physical activity pretty quickly, 2 to 3 weeks. A lot of times I would like to have them to have a brace, and all my athletes, I will have them see physical therapy just to strengthen, to have an assessment, just to prevent any kind of re-injury. Now, in a grade 2 sprain, the ligament's partially torn, so it's not completely torn, but it's partially torn. And in those instances, we will have the patient immobilized in a cam walker boot, sometimes in a cast, and then they'll require bracing and then physical therapy once we get the swelling down. Those typically take about 6 to 8 weeks for them to heal appropriately to get them back to the activity. And then in a grade 3 sprain, that's what happens with that is one or more of the ligaments are torn, and we need to immobilize the patient and allow that area to scar itself down. One of the most important things that I do for any kind of sprain, whether it's a grade 1 to grade 3, is to try to control the swelling. I think that's most important in getting the patient back to their activity quicker. So I'll put something called an Una boot, which is a soft wrap. It's basically gauze that has zinc, calamine, glycerin impregnated within the gauze. Then I'll put some web roll around it, and then Coban, which is that squishy type tape. The premise behind that is as the patient or athlete is walking, if they can walk, it helps pump the fluid out of that ankle. And what that does is it helps decrease the pain in that region. And then when we see the patient back, we typically leave that on for a week. We'll evaluate the patient again, and we can pinpoint the actual area of injury, and we can address that.
What proactive things should athletes be doing to try and prevent an ankle injury?
So they definitely want to have a warm-up period. So before they perform their physical activity, their sport, they want to do warm-up, whether it's stretching, light jogging, running, just doing certain activities that will help strengthen that particular limb. Well, in the high school athlete, all the schools typically have a trainer now. So the trainers work out of a physical therapy facility. I would contact that trainer. Don't be shy and talk to them and say, hey, what can I do for my sport to strengthen the particular limb, whether it's foot, ankle, arm, knee, just try to get that addressed and to prevent any kind of injury. And they're more than willing to help let you know where to go. And most importantly for anything, especially in the foot and ankle, is proprioception training. That's knowing where you're at in space and time. So when you jump up for a rebound or go for a layup, you want to know your feet are coming underneath you. If you're a gymnast or a cheerleader and you're coming down after a stunt or dismounting, you want to know your feet are going to be there. You can feel them. So that's what proprioception comes into play, is where you know where you're at in space and time. So if you work on the proprioception, you strengthen your core, that's going to be the best thing you can do to help prevent any injury.
And for those of you who are listening, be sure to check out the recent Game Changers video on how to strengthen your ankles. And doctor, going back to you, when is an ankle injury something you should treat at home versus when it's time to see an orthopedic physician that specializes in foot and ankle injuries?
I guess a good rule of thumb is if the athlete cannot apply full weight on the foot after the injury, then they should seek immediate evaluation. If it's just a light little sprain, you have a little bit of swelling, you can implement the RICE, which is the rest, ice, compression, elevation, and see how that goes over the course of the next several days. You can take anti-inflammatory medication and see how you feel. If you're not able to put full weight on it, there could be something more serious going on, whether it be a fracture or ligament tear. So most patients will go to the ER, urgent care, whatever they're more comfortable doing, but ultimately the urgent care ER is going to send you to my office or another specialist that treats these types of injuries. And with our clinic here at Specialist Orthopedic Surgery here in Valley Sinai Hospital, we'll get you in if it's early enough that day. We'll see you the next day. We have non-operative sports medicine specialists. We have surgeons. I do all the foot and ankle here at the clinic. So we'll get you in. That's the best thing for you. All the local trainers have my phone number. So if there's an injury, they give me a call and we fit you in. Our goal is to get the patient back to their activity quickly, but also as safely as possible. So we don't want to rush you back, but it's kind of critical to have it addressed pretty soon after the injury. If you go to the ER or the urgent care and say, go see your specialist in a week, you're losing a week of treatment that could be critical in getting you back. Our seasons are short as it is, and especially now with the COVID, they're even shorter and compressed. So if we have an injury, we want to start treating that almost immediately.
Because of the shortened seasons, have you been seeing an increase in ankle injuries?
No, not more than normal, which is good. But what I have seen in a couple instances is actually some stress fractures. Normally, stress fractures are rare in young athletes, but I have been seeing that. I think it's due to the overuse. We're having a lot of athletes participate in basketball and soccer simultaneously. If you have your athlete participates in dance or cheer, those are sports that they don't just practice for an hour per day. They're 2 to 3 hours per day, some even more. And so the constant stress, constant load can cause the bone to fail. And I have seen this in rare instances where stress fractures are becoming a little bit more prominent than just your local sprains or just injuries where there's a fall and then we have a fracture.
Well, we're wishing the best to all of our injured athletes out there. If you have an ankle injury or other sports injury that has you sidelined, call the orthopedic and sports medicine specialists at the Detroit Medical Center. Call 1-888-300-DOCS. Doctor, thank you so much for your time today.
Thank you for having me. Appreciate it.